the Science Guy. Bill Nye, the Science Guy. Bill Nye, the Science Guy.
The Coco the Science Bro, brought to you by ACE inhibitors. Without ACE inhibitors, you ain't controlling your blood pressure.
ACE inhibitors!
ACE inhibitors.
ACE inhibitors.
Angiotensin-converting enzyme inhibitors are one of the many heart medications that we use to lower blood pressure. But how do these ACE inhibitors lower blood pressure? Before we get to that, let's explain a few uses of ACE inhibitors. Let's see if our way cool PA can help us with the type of patients we prescribe ACE inhibitors to. Bring in the experts.
Hi, I'm PA Mike and I'm here at Stony Brook University Hospital where I see lots of patients who require being put on ACE inhibitors. So ACE inhibitors can be used for both cardiac and non-cardiac therapeutic uses. Cardiac uses would include increasing the survival in congestive heart failure, decreasing left ventricular hypertrophy, hypertension, heart failure, or left ventricular dysfunction. It also decreases the risk and prevents atrial fibrillation and prevents strokes and heart attacks. Some non-cardiac uses would include preventing and treating kidney disease and decreasing proteinuria in diabetics. Thanks for listening. Back to you, Coco the Science Bro.
Thanks to our way cool PA for sharing. Where were we? Oh yeah, that's right, ACE inhibitors. Let's take a walk into my office. Alright, so ACE inhibitors are part of the many drugs that affect the angiotensin-aldosterone pathway. So, angiotensin is produced by the liver. Angiotensinogen is converted into angiotensin 1 by renin, which is produced by the kidney. Angiotensin 1 is converted to angiotensin 2 by the ACE enzyme, angiotensin converting enzyme, which is produced from the lungs in the majority and the kidneys in the minority. Angiotensin 2 has direct effects on epinephrine and norepinephrine to cause vasoconstriction in the body. It also has the effect of increasing aldosterone. Aldosterone causes you to reabsorb sodium and water in the tubules of your kidney, and therefore less goes into the toilet. So what does this have to do with blood pressure, and why are we talking about it? Well, that's because vasoconstriction and having increased water coming back into your system instead of getting whizzed out to the toilet increases your blood pressure. So when we have an ACE inhibitor introduced, it prevents all this from happening. So this goes down and this goes up. ACE inhibitors block the conversion of angiotensin 1 to angiotensin 2, like this. Sit. Sit. ACE inhibitors help decrease the heart's workload. They all end in pril. Some examples: lisinopril, enalapril, lisinopril, and ramipril. Taking ACE inhibitors can be some serious business. They can result in many adverse effects. Let's take a look. So the first adverse effect we're going to talk about is dry cough. And the next one we're going to talk about is first dose hypotension. And who's to forget hyperkalemia? And I don't know about you, but my worst nightmare is angioedema. And renal failure in people with bilateral renal artery stenosis, and even fetal harm. No Prego. So how does one take an ACE inhibitor? Good question. ACE inhibitors can be given orally or through IV. Each dose depends on which medication is given and whether or not you're an adult or a child. Did you know? ACE inhibitors are contraindicated in pregnancy. Pregnant women require extra blood volume because they are perfusing not only their own bodies, but the life growing inside their own. So decreasing blood volume decreases blood perfusion to the placenta. Ultimately, it decreases fetal nutrition and growth. There you have it, folks, ACE inhibitors. Just before we're done, I have a special guest. MC Inhibitor himself is going to give you a way to remember all the ACE inhibitors and their actions.
Decreasing renal perfusion, renin goes into the blood. It converts angiotensinogen into angiotensin 1. Angiotensin converting enzyme transfers H1 to H2, which has a multitude of effects. Direct vasoconstriction, synorrhapy and epi, increased aldosterone, it does the rest. Cause without an ACE inhibitor, blood pressure stays high. Cardiac remodeling, there's a slight chance you might die. Fun fact, all ACE inhibitors have the suffix name pril. Tune in for the next verse, it will be a thrill. Blood pressure is way too high. Blood pressure might cause you to die. Since bradykinins are still here, you see you get a dry cough. Hyperkalemia, angioedema. First dose hypotension too. Contraindicated in pregnancy, congenital malformations in babies. So make sure that you're taking something else. Helpful in diabetics by decreasing proteinuria, increases CHF survival too. So we hope that you enjoy blocking angio2. I know the other groups, they have interesting facts too. Exercise and diet, be sure to watch your stress. By following our tips, you're bound for success. Blood pressure is way too high. Blood pressure can cause you to die. Go to the PH today, and you'll be glad that you came. Yeah.
Well, that's our show. Thanks for watching. If you'll excuse me, I have some studying to do for a cardio exam. See you afterwards.
Produced in association with Back Row Squad, Stony Brook University Edition.